Good morning or good afternoon, depending on where you are across North America. This is Eric Bruns. I am co-director, along with Janet Walker, of the National Wraparound Initiative. The NWI hosts regular webinars on topics of interest to the field of children's behavioral health and systems of care and use of the wraparound process. This is the fifth webinar that we've done this year, and we are ever so pleased to have with us a very dear friend, Bruce Camrat, who is going to be discussing the individualizing care for children with complex needs by developing a comprehensive service array and provider network. Bruce is eminently qualified to be with us discussing this topic today. Bruce is the director of Wraparound Milwaukee in Milwaukee, Wisconsin. Wraparound Milwaukee was launched in 1995, and when I was a graduate student, which was when I was a graduate student, and as I was progressing through doing research on Wraparound with my mentor John Burchard, Wraparound Milwaukee pretty quickly became a standard bearer for how best to organize systems and providers to better meet the needs of children with multiple agency involvement and complex needs. So Wraparound Milwaukee now serves 1,300 youth annually, and over 50% of these children come from families at or below the federal poverty line. In 2009, the Ash Institute for Democratic Governance and Innovation at the John F. Kennedy School of Government at Harvard University announced that Wraparound Milwaukee was the winner of the Best Innovation in American Government Award. So this was a real feather in the cap of Wraparound Milwaukee and appropriately recognized Bruce and his team for the work that they've done in better providing systems that provide effective services for children and youth so that they can live in their homes and in their communities. So we're really thrilled to have Bruce here today. And as I said, he's going to be discussing something that's been a hallmark of what Wraparound Milwaukee has been able to use in order to achieve better outcomes for children and families, which is being a central organizer of a comprehensive service array and provider network. So I'm going to, with that, we will take care of a few housekeeping items, I believe, and then I will turn it over to Bruce, who is joining us from his cabin in northern Wisconsin. Bruce, before you get started, here's some of the rules for participants out there. Please move any electronic handheld devices away from your computer speakers, close file sharing applications. Check your settings in the audio pane for the webinar if you're experiencing any audio problems. Now, during the presentation, you can send questions to the webinar organizer, but we're going to hold those until the end, and then we'll facilitate a process of getting those questions to Bruce. He'll be muted until the Q&A session occurs, and during the Q&A, you can raise your hand if you'd like to verbally ask a question. And if you're calling in over the phone, remember to enter your unique audio PIN so we can unmute your line. And finally, people always ask this question, this webinar and the PowerPoint will both be available on the National Wraparound Initiative website. So with that, any more housekeeping, Sarah?
Nope,
I think with that, we're gonna hand it over to Bruce Camrat, who is the director of Wraparound Milwaukee. Thank you very much for being here with us today, Bruce.
Thanks for inviting me, Eric, and it's great to talk with you again. Hopefully everybody correct. I am calling from northern Wisconsin, in specifically about 90 miles northwest of Green Bay on a small lake. So through the miracles of technology, we do get wireless up here, and we are able to do this. So hopefully, they were saying that sometimes I might break up a bit, but hopefully everybody can hear. As we talk about Wraparound, and I appreciate the introduction from Eric, and I think the nice thing about winning the Harvard Ash Award as the Best Innovation in American Government was that it recognized, because we were the first system of care for children with serious emotional and mental health needs to ever win the award. So I think the feather in our cap is, I would hope a little less for us than it is for all systems of care, the recognition that carries to the important work that is being done out there, and I'm sure by the close to 200 listeners I see that we have today. In talking about Wraparound Milwaukee, I'm going to give a little bit of background, because when you talk about the provider network and how that was developed, we have to really put it in the context of what our program is, how it's funded, and it then makes more sense. But it's an important subject, and individualizing care. The one way we are able to do this, whether it's in Milwaukee or elsewhere in this country, is by having an array of services and providers to deliver that. But let's start a little bit about what is Wraparound Milwaukee. And bear with me if you've heard me before, or you know our system really well. But we're a unique system of care. There are many in the United States, probably in all 50 states, for children and their families who have very serious emotional, mental health, or behavioral needs. And we serve kids that cross 2 or more child-serving systems, so mental health and child welfare, or mental health and juvenile justice, or mental health and special education, who have a condition that's fairly chronic, it's persistent for 6 months or more, causes some functional impairment at home, school, or in the community, and importantly, places them at risk of placement in their group home, juvenile correctional care facility, or psychiatric hospital. So it's not an early intervention program, but it is a system for kids that cross all the other child-serving systems that end up otherwise in institutional care. Now, we're operated, many people think Wraparound Milwaukee is a private entity. Even people in Milwaukee think that in many cases. But actually, we're operated by Milwaukee County. I work for county government, and we're operated by the Milwaukee County Behavioral Health Division. And I serve as director of county, as well as being director of Wraparound Milwaukee. But we're very unique in that the Wraparound Milwaukee program within the Behavioral Health Division functions as its own managed care entity. And it pooling funding across, and I'll talk more about that, child-serving systems and managing the care of all children in the target group, kids with serious emotional and mental health needs, regardless of what system they come from. Or even, Eric was saying 1,300, but we'll serve over 1,500 families, and we operate with an annual budget of about $45 million. Going to the next slide. Some of the administrative and service structures of Wraparound Milwaukee, in terms of what it does, is very, very unique. And not every system of care will do everything we do, but we're probably one of the most robust systems, and we've been doing this, as Eric said, for 15 years. But some of the things that Wraparound Milwaukee does administratively and in terms of the structure, we screen and assess youth for appropriateness to come into the program across all the child-serving systems. We enroll, meaning that we do the Wraparound Milwaukee, which carries with it enrollment in our managed care entity, but general enrollment into the program, so that's a function. A function that we're probably all familiar with is care coordination or care management or case management, although we like to refer to it as care coordination, which is a care coordinator who facilitates the child and family teams because families really develop their own care plans. But the person who facilitates that and who plays the important role of family identify and obtain services from what I will talk with, the provider network. Obviously, the fourth thing, and what we're going to talk a lot about principally today, is develop and maintain a provider network.